you so much for that, Paulette. And up next, we have a professor. We have Professor Nadey Hakim. Under his name, he has MD, PhD, Honorable D, Arts, and he is also here to talk to us about skills, not scars, and an international perspective. So if you want to give a round of, oh, here he is, for Nadey Hakim.
Ladies and gentlemen, Mr. Chairman, good morning. First, I'd like to thank Charles Kwaku, the CEO of CAN, for inviting me to be here today, and I'm so humbled and impressed by the crowd here today. I'm going to talk about what I call skills, not only scars, and I'll explain to you what I mean by that. First, I'd like to make a declaration of interest. You'll be surprised to know that I'm Nigerian myself. So, and obviously proud to be. So this is my declaration. So I'd like to talk about black health and kidney transplants. I've been a kidney transplant surgeon, other transplant surgery for the last 30 years. So obviously I've dealt with a lot of patients in the NHS. But in addition, I thought, as the president-elect of the Transplantation Society, to offer my skills and training, as Mrs. Hamilton mentioned, training is very important to people in Africa, on the African continent. So I will not be very long. I know I have only 10 minutes, but for the last 13 years, I've been traveling to Africa as a single surgeon, because obviously I go on my own and I offer my skills. And I've done over 350 live-related kidney transplants, and they're all kosher kidneys. All the transplants are done because the HLA is done in the UK and confirmed that the live-related is indeed the case. There's no cheating going on, so I insist on this because this is my job as the Transplantation Society president. And we follow what they call the Istanbul Declaration. You can look it up. So I've been to 3 West African countries so far. I started in Nigeria. I've done transplants in Abuja, Lagos, and Accra. And soon we'll be doing some in Liberia, Zambia, and all the way to St. Kitts, because obviously we deal with the Caribbean islands too. I was invited by the Prime Minister of St. Kitts to do the first kidney transplant there in not too long. We're just looking at the first donor recipient. I'm going to show you some pictures. That's, I think, the nicest way to present. This is in Abuja, where the nurses, doctors, and actually the gentleman in the middle is my own son, who goes with me. He's a transplant trainee, vascular trainee at St. Mary's Hospital, so he goes with me to help me with the transplants. Actually, as a matter of fact, I came back on Monday from Nigeria. I was there for 2 days, where I performed 7 kidney transplants in 2 days. Now, to give you an idea, 7 kidney transplants, meaning 14 operations, because I have to do the donor and the recipient. I can tell you in the NHS, it will take 3 months to do 7 kidney transplants, live-related, and I'm not exaggerating. So to do 7 successful kidney transplants and flying back on Monday morning is I'm sure you agree, a big challenge. But I was, thank God, confident enough to leave the patients with the local surgeon, but I'm very comfortable that they will do well, and I keep in touch with the hospital by WhatsApp with the results. So this is one of the hospitals in Abuja. It's called the Caroline Medical Center, with the nurses, doctors, and when I transplant, all the surgeons in town will come and observe, and I take them through transplants too, so they learn. And this is what I mean by leaving skills and not just scars behind. So I don't know whether somebody can start the video. Yes, just to show you, this is a true video of there's no lift in the hospital. These are donors which were done the day before. And look at this. They are walking down the stairs to go to the room to give space to other patients. So look at them. They are walking as if nothing happened. These are 2 donors out of the many, many, many donors we've done. So to give you an example of how healthy they can be immediately post-op instead of and offering their kidneys, which I always say is such a priceless organ to offer. So this again, if you can show the video, please. You are the last patient we've done last night, and you're doing very well. Kidneys functioning nicely. Well done. All good? Happy? Well done. No problems, no complications, nothing. So see, it's very quick walk round because I know they're doing well. I don't have to spend an hour with each patient, just one after the other. Otherwise, there's no time. No problems, you have all good, happy? African patients are the ideal patient, I can tell you. Perfect. They're always happy. Yes, very well. Always happy. You must be happy. Next, please. So this is actually a story, a patient who I've done many, 2-3 years earlier, and I bumped into him at the hospital. If you could run the video, please. He will tell you what he thinks about it, please.
I had a transplant, kidney transplant 7 months ago. The surgery was successful. And 7 months plus now. So seeing them, coming to them, I feel happy and delighted.
Fantastic.
Thank you very much.
You know, when I saw him today, I looked at him and I thought this guy must have had a successful kidney transplant.
Yes.
Because he looks so good, so healthy.
Remember to do your follow-up. You are doing very well. You are looking good. Professor Nadey, Hakim, thank you very much.
This one, actually, this is a picture taken just this weekend. This lady comes to the hospital and says, "Oh, you don't recognize me." I said, "Sorry, no, I don't recognize you." She said, "You did my transplant 6 years ago." And she came with her husband, and as you can see, I mean, she's amazingly with a perfect kidney function. This is what is good about transplantation. You see, this is you plant that seed, and 20, 30 years later, you see patients doing very well. Now we move to Accra. This is UGMC. I don't know, there must be some Ghanaians in the room. UGMC, 11 kidney transplants done last year in 2 visits, and again, did very well. This is the MDT before the transplant with all the team. You know, the gentleman, the second gentleman on the right here, or left to you, sadly, there's a very sad story. He was the chairman of the department. 2 months after all this, he developed, unfortunately, gastric cancer and died. So that was very sad. So you see here, I'm with Mary, who is the senior urologist, doing the transplant with her, showing her how to do it. Big theaters, UGMC is quite impressive. Actually, it's even better than any hospital I've seen in the UK. It's very, very good. 12 operating theaters, outstanding. And you see, this is the intensive care. Everybody wearing gowns. You'll never see this in London. I mean, it's unbelievable. Everybody, you're not allowed to breathe inside the ITU unless you have got the mask and the gowns. They are very, very, very impressive. This is actually going to Lagos. We're traveling all over the world. Lagos at the St. Nicholas Hospital. I'm sure you've heard of it. That's where they've done the first ever kidney transplant in Nigeria. And I go and help them with Dr. Ibun in the middle here, Bang Boy, you've probably heard of. And this is the last transplant, one of the last transplant done in Lagos. And you can see this is a huge ascites. I land in the morning and said, "You're going to transplant this gentleman." I said, are you serious? He said, yeah. There were 25 liters of ascites inside that abdomen, so which I had to suck out and transplant this patient who was, in addition, HIV positive. So a lot of demanding tasks. So, ladies and gentlemen, I've got 30 seconds left, and I will be respecting my time. So thank you so much for your attention. Thank you.
Well, that was amazing to watch and very inspiring. We're going to now move on to our next speaker.